There's no shortage of complaints about the healthcare system in the Eastern Cape, isn't it?
Yes, the Eastern Cape is under siege with the amount of medical negligence claims that it's owing on. It's owing 17 billion rand, which is 72% of its 23.6 billion rand annual budget, which is a huge chunk of money. This is hurting service delivery in the area. As you can imagine, most of the cases are coming from the Nelson Mandela Academic Hospital and the Butterworth Hospital. These hospitals are feeder hospitals. So what happens is an emergency case is found in a hospital in the rural areas. That person is then transported to this hospital. In many cases, especially in maternity cases, by the time the woman arrives here at this hospital, it's already too late. Many of the women give birth to babies with cerebral palsy. They give birth to stillborn babies because of a lack of oxygen. So the claims are then put against these hospitals because this is where the patient ended up. I'm now joined by Advocate Vuyani Khunju, who deals with many of these cases. Thank you so much for joining us.
Good morning, Cindy, and thank you for having me.
There is a serious lack of record keeping, especially in maternity cases. As you can imagine, nurses and doctors are under stress, especially when something is going wrong. How do you defend a case without records?
Well, Cindy, it's a mammoth task. But at the end of the day, you need to investigate a particular matter entrusted upon you. And in those circumstances, what you do, you basically have one version, the plaintiff's version. That is the complainant's version. And in order for you then to investigate is that the option that you have, in my experience as an advocate, is to refer the matter to a specialist, an obstetrician and a gynecologist. And an obstetrician and a gynecologist will investigate the antenatal care if there are issues that occurred during a pregnancy, and then they will give you an opinion based on that. Those will be intrauterine problems in medical terms. And then as well, you must have a pediatrician's report to investigate what the condition of the baby was immediately after birth. Then you also have to have a radiologist report to check what sort of injury pattern that is there. For instance, you could have a partial prolonged brain injury. You could have an acute profound injury.
So it seems really complicated, and you've got to go to quite a long extent to be able to deal with these cases. How do you think that the department can address this lack of record keeping in these areas?
Well, I would imagine that there must be a system or a mechanism of doing that, be it electronically, because you can't expect doctors and nurses during typical times to record each and everything. To my mind, it seems something must be done in that regard. And I think at some point during a particular workshop or summit, the department did mention that, and I think it's working on matters of that nature.
The department has said that there have been unscrupulous lawyers who are touting patients in these hospitals. How does that impact on your cases?
The case that is normally presented to you, it is based in delict, law of delict. The touting has no play in the analysis or inquiry as to whether the matter was negligently handled. The principles of delict would require that you establish negligence, wrongfulness, causation. Those are some of the inquiries or issues that arise in court. The question of or about touting really does not arise. You see, because touting does not render a baby brain damage.
Thank you so much for joining us. I really appreciate it.
Thank you so much.
As we have just heard, record keeping in crisis situations, in maternity wards, is affecting the medical negligence cases. It hampers the lawyers defending these cases, and this is something that the department needs to address.
All right, eNCA Sandy McCowen in Mthatha.